Welcome everyone to this mPower regional learning event. We basically wanted to share with you some of the work that Plymouth and Nottingham have been doing around looking at newer ways to engage and work with taking a more people-centered approach to fuel poverty and sort of alternative ways of financing that.
Back in the early noughties, the council recognised that they alone were not going to get to where we needed to in terms of energy transition and fuel poverty, and set aside to help a community-run organisation, a community-owned organisation, to establish that would try and tackle some of the energy issues. And that was back in 2012. Some of the key issues we were looking at there: fuel poverty, trying to cut energy companies out of the local economy and have more kind of circularity of funds in the local economy, and trying to increase renewable energy. All that formed an organisation called Plymouth Energy Community, and that's grown enormously in the last 8 years. We own 32 installations of solar panels in the city, including a 5 megawatt solar farm. We have a team of, I think, about 10 advisors now delivering fuel poverty work in the city, with huge impacts. We saved people in the city about £1.3 million last year as a result of the advice we delivered, and that's savings within a year of the advice, helping over 2,000 households with one-to-one support around energy. We've also got various new ambitions. We have a new housing project. We're trying to build 70 affordable zero carbon houses in the city. We've got art-based energy engagement projects. And the area that I'm talking about particularly today is some of our retrofit projects that are coming in. With the LAD funding I was talking about, the crucial thing we wanted to do is disrupt that model where a local authority procures one installer to deliver that, and they are in charge of the whole process. And we wanted to move to a system where the council acts only as a grant body, so it grants funds to householders, so it puts the householders in charge of what happens in their home, and it can do that with any installers that meet their eligibility criteria. And we make sure that the householders then have an organisation to support them to make those decisions. So Plymouth Energy Community then coming in to provide advice and support to households, including accessing retrofit coordinators and retrofit advisors to provide that. Alongside that, we also maintained a recommended installers list. So we did a lot of work to engage with the installer market locally, and to establish what offers people could provide, so that again we can provide customers with something to help them make those decisions and access what would be best offers for them. That is quite a different model than, it's not unique. There are other people who've done similar things in the country, but it is quite a different model than that traditional model of procuring one installer to manage all the works, to manage all the eligibility and the kind of grant process for that. And actually, we think there's been a really good impact from that. It's by no means a perfect model, and I'm not going to hold this up as exemplar of a perfect project, but I don't think anybody would of a LAD project that they've been delivering in the last year. And the headlines of that, we didn't spend all the money. We were not surprised by that. It was an ambitious project, but we did help 127 households retrofit their homes, an average spend within that of about £9,000. So some quite in-depth retrofit in there. One of the really key things happened there is almost all of that went to installers based within our local economy. And we thought that was important to begin with, because those are installers whose futures and their rely on their reputation locally. These are installers who are, not normally involved in the eco supply chain, for example, the energy company obligation, kind of national funding supply chain. And so they are used to doing their work locally based off their reputation. So this, we felt, was really important to make sure we're getting the best value and make sure that we're delivering good quality work. This is, better than writing in a whole load of clauses in a contract about what regulations you have to stipulate to. This is a really natural way of making sure you're getting really good work. And some of the results from that in terms of feedback from households was also really strong. Again, we did get that sense that having an independent organisation providing advice that is focused on giving the best advice to the household and supporting them through the process made a big difference in terms of households going through the scheme.
So in the carbon reduction, energy and sustainability team, we've host a domestic energy efficiency and fuel poverty subgroup, which is a subgroup of the Health and Wellbeing Board, and that reports on fuel poverty across the city, with the main aims to reduce energy bills, improve energy efficiency, and maximise household income. The progress to date, we've got a successful track record, as the previous slide shows, of applying for funding bids and supporting households across the city. The latest stats for fuel poverty show that there's nearly 19,000 households in Nottingham in fuel poverty. That's based on the low income, low energy efficiency from 2018-2019 data. I'm expecting the new data to be released in the next few months for the 2019-2020. So we've got the domestic energy efficiency fuel poverty subgroup keeping a track of this. The group is a stakeholder engagement with Nottingham Energy Partnership, various departments across the council, including the housing team, Age UK attend, the universities have input into it because quite a lot of the student areas show us high fuel poverty areas in the city. Nottingham City Homes are present. So it's across the city working on fuel poverty projects and engagement with citizens. Challenges that we face often come with implementation of the funding within the timescales available. Justin mentioned this with LAD as well. That's been a challenge, and the funding calls sometimes don't always align with what the council can implement or what's already going on. With LAD as well, there was an issue with getting qualified installers to do the work within the time frame, and that was addressed by having a training programme running alongside LAD, which was welcomed.
So the concerns first, I think two of the main issues we've been concerned about is that actually a lot of the programs which are there to retrofit the homes of people in fuel poverty are not benefiting the most vulnerable people. Second one is that actually they're not delivering effective, efficient retrofit programs at all. There is an opportunity through things like LAD funding that's coming through for local authorities and HUG funding that's coming through to local authorities, but that's not enough. It's not going to cover it. And really, there are a whole load of other beneficiaries when we retrofit a home: the occupant, landlords, health services, local authorities, district network operators, who all benefit in some ways from this. And how is there a way here that we can actually start to bring together these partnerships to provide some of the things we need: trustworthy advice and support, better resources to do a whole house retrofit, and longer term investment horizons that can kind of galvanise the installer network and galvanise our services to deliver things more efficiently.
So starting with thinking about why take a person-centred approach, I think sort of the key message from this research is that properties don't experience fuel poverty, it's people that do. And vulnerability to fuel poverty is only partially about the property that people live in, and we can learn more about fuel poverty if we think about it more in terms of energy vulnerability of the individual and the household. People experience fuel poverty in different ways. So the initial symptoms of fuel poverty can be quite wide-ranging, and it's not just high energy bills, it can be about rationing fuel and ways to cope with being cold. And the detriments that people experience as a result of that are also different for different people. It could be poor physical health, it could be financial strain, it could be family relationships. But those detriments have a wider negative impact than just that household. It's going to affect other stakeholders that they interact with, their doctors, their landlords, their employers. So a person-centred approach helps in two ways. Firstly, to identify interventions where they might be most beneficial, taking into account what individuals are vulnerable to and what they're suffering from as a result of fuel poverty. And secondly, to look at that wider impact of how those stakeholders are affected, and how they could potentially help or could benefit themselves from helping those individuals. So the idea is that if we can better target fuel poverty interventions and what people are suffering with as a result of fuel poverty, you can deliver better outcomes for those households and individuals. And then the aim is that will have a positive wider impact on those other stakeholders, so deliver co-benefits to them. And that's kind of the foundation for the research, that a person-centred approach can better target vulnerable individuals and households, promoting a worst-first approach, but that also it supports a more holistic approach based on the knock-on impacts on that wider group of stakeholders. So the persona approach, these are archetypal users. They embody real users, but they're not individual case studies. They're based on a broader evidence-based, but they're easy to assimilate in their interpersonal form. As I said, they're based on wider evidence from this literature review, which is, they're only good as the evidence they're based on. So that's why we started with the literature review. But they help summarise that in a way that we can kind of present and understand. So it helps us focus on who we're really looking at when it comes to fuel poverty, so we know that, and then we can have a kind of user-centred design that we have a clear focus on who you're trying to help. And I think most importantly in this case, when we're trying to engage a wider group of stakeholders, it presents that evidence in a really personal and believable way that engages the empathy and interest from stakeholders. I think we can't take in a broad amount of data, it's difficult to absorb that, and our brains respond better to stories that engage our emotions. So the aim is to have that sort of engaging approach, but it's based on the evidence, it's not anecdotal. So we developed 6 personas, which between them cover all the kind of vulnerable characteristics and the symptoms and detriments that we identified in the fuel poverty literature review. So the first one is an older homeowner couple in worsening health and mobility. The second one is an older single person in rented accommodation with worsening health. And the third person is a single parent in rented accommodation, a large family in rented accommodation, a family with a disabled adult or child in a home that they own with a mortgage, and a young single person in rented accommodation. So those 2 personas hopefully have given you some indication of who might be impacted by fuel poverty and how that kind of differs, and that detriments don't just impact individuals but will have a wider impact on the stakeholders that they engage with. So again, the model that you can now sort of see is demonstrated through the causal chain that's in the evidence, shows that those positive outcomes lead to a positive impact on a wider group of stakeholders. Just to quickly summarise, I mentioned some of them. So obviously health service, fewer use of their services and financial impact on them. Employers in the local economy, so there's also evidence that people have fewer sick days following energy efficiency works. There's a broader economy benefit from having jobs in the green sector and that supply chain, and potential economic effect through the rebound effect to higher spending. Landlords, I mentioned, have a lower tenancy turnover and vacancy, but also have increased property value if they upgrade their homes. Energy suppliers have that reduced arrears and debt collection costs. And then the energy system, the district network operators more broadly. There's research particularly from the US that shows the benefit to them from actually having lower energy demand. It means the demand during peak times is reduced, so that they don't have to invest as much in the reserve systems to handle peak loads, and they just generally have lower need for lower generation costs. They can defer their distribution upgrade and reduce line losses. So some kind of technical ways in which the energy system benefits from having lower demand. So just quickly to conclude, so this person-centered approach we think could be more effective by targeting those most in need according to the symptoms and the detriments that they experience. And hopefully the personas developed through this help convey that evidence. And it highlights the wider impacts and then also identifies those stakeholders that are affected. And the potential benefits from working in partnership with those stakeholders is they can help identify those target groups who are displaying those symptoms, either through their frontline staff or other data that they hold. And then those mutual co-benefits might financially benefit those stakeholders, so that might give them the incentive to co-invest in fuel poverty initiatives. So we think that a person-centered approach is therefore compatible with this kind of holistic partnership approach.
The answer that it gives us a much more long-term investment platform, and also might answer some of these questions, is to look at those beneficiaries that benefit when we retrofit a home. And there are lots of them, and Alice has highlighted some really key ones in there, and who benefit quite a lot when we retrofit homes. And how can we then work in partnership with those beneficiaries, hopefully for them to bring some resource to the table, whether that's financial resource, whether that is collaboration and better working practices. And there are lots of examples of where this is done in very small ways. What we're looking at with this project is where's the capacity for us to do that is a much more kind of holistic program. The person-centered approach is really important to that, because if we're approaching a clinical commissioning group, the arm of the NHS that does the commissioning in the local area, to say, look, how can you help us to deliver retrofit to more homes? And we say, and what we'll do is we'll do that just to all homes in fuel poverty. It's a less convincing case than us saying, we want to work in partnership with you to access those homes of people who are frequently accessing your services, people who've got respiratory issues, people who've got mental health issues, those kind of issues. That's where our focus is going to be. And if you can bring some resource to the table here, that can allow us to focus this grant funding we've got coming in to those households and to do a better job of helping them than if we were just doing it with the grant funding alone. Landlords, owner occupiers, they all have a stake in this, and with the right, and it may not all be more grant funding, some of it might be finance. So for example, a lot of householders, a lot of homeowners have got a lot of capital in that house. Again, if you can find the right approach, if you can find the right investment finance to support them to go further than the grant can take them, to make sure that we can properly address the issues of their home, there are people who are interested in doing that. So with that person-centered approach, it's both a tool to have a look at how we focus our work when we are implementing projects to improve homes, but also how we can focus our engagement with those stakeholders. There are examples of this, and we don't have the time to run into those examples necessarily, but those happening in health services combining with fuel poverty services. For example, we're delivering a landlords project that's doing a similar thing. There are local authority-based loans to support householders to do this. These are kind of working, but there's a feeling now that we need to draw that together in a way, and having different relationships coming together as a kind of big retrofit partnership for cities, and that's what this project's about.
The real sweet spot is when you bring these anchors together as a network, and CLES have done this work in quite a few places now across the UK to establish these networks. And the kind of most well-known example is Birmingham. I'm sorry if this is a bit blurred. So Birmingham is an anchor network made up of 9 anchors actually, including the NHS Trust, 2 housing associations, the council, 2 of the city's universities, and the police. And the work that they've done in Birmingham really focuses on pulling together a collective holistic approach to, in particular, 2 of the 5 pillars, procurement and workforce. And the most interesting example, I think, for you guys, just for context, is workforce. So the work that they've done is that the NHS Trust recognised that they had a massive gap in terms of their recruitment. They weren't able to get local people into jobs, and also they were struggling to recruit in general, and this was through the pandemic. And the local housing associations recognised that they also had a lot of people who lived for them who were struggling to find employment, struggling to retain employment, and also there was a gap in terms of pre-employment support for them. So off the back of this and through the Anchor network, those 2 institutions got together and firstly used the housing association's deep connections into their local communities to basically support people into a position where they could explore recruitment with the NHS. And the NHS used the housing association's expertise to break down all of the sort of recruitment barriers to those people. This is fascinating and really needed. I think the personas work, and the fact that this isn't just about housing stock, it's about people's experiences is really important. This is a public health priority, it's an economic priority, it's a housing priority, it's an energy system priority, and it's a priority when we're thinking about more broadly tackling poverty. It's clearly cross-sectoral and it really requires deep collaboration to drive change. So we find that setting up anchor networks with a clear action to start with is a great way to get them moving, and why couldn't that task be retrofit?